Welcome to Dr. Joseph Pergolizzi's webinar on how to control acute and chronic pain naturally. The goal of today's webinar is to help you manage your pain through lifestyle changes, including targeted nutritional supplements so that you can enjoy a good quality of life as pain-free as possible. You can ask a question at any time during this webinar. Just type your question into the Ask a Question box that appears on the left-hand side of your screen and then hit Submit. Dr. Pergolizzi will answer as many questions as possible at the end of the presentation. If you have a question that isn't answered today, please feel free to connect with Dr. Pergolizzi on his blog at healthydirections.com. And now I am very excited and pleased to introduce our presenter, Dr. Joseph Pergolizzi. Dr. Pergolizzi is a senior partner at the Naples Anesthesia and Pain Associates Group of Southwest Florida and an internationally recognized expert in pain medicine, anesthesia, internal medicine, and clinical research. After graduating from St. John's University and the Ross University School of Medicine, Dr. Pergolizzi completed a residency in anesthesia at Georgetown University, as well as a fellowship in research at the Johns Hopkins University School of Medicine. As he became increasingly interested in the science of pain, he began to focus his career on studying what pain is, why it occurs, and how best to treat it. Welcome, Dr. Pergolizzi.
Aaron, thank you very much for having me this evening. And I want to thank all of the webinar attendees for participating. Hi, my name is Dr. Joseph Pergolizzi, and I'm a pain management specialist with over 20 years of combined research and clinical experience in both acute and chronic pain management. Our webinar tonight is focused to allow you to get an insight into pain management, so that you can get a better control of your pain and you can also reduce that pain and how it's affecting your life and reduce the suffering related to that pain. So how big is this problem of pain in the United States? Staggering statistics show that over 1/3 of the adult population in the United States is reporting chronic pain annually. That results in over $635 billion in healthcare costs when we look at managing or addressing the impact of chronic pain. Chronic pain and acute pain are the #1 reason why patients are going to be seeking medical care in the United States and globally. And that's something we have to realize, because at some point in time, all of us, unfortunately, are going to experience some type of pain in our life. And that's important to realize, because pain can be both a physical type of event as well as an emotional aspects as well. So it's important that you realize the type of pains that may be out there and that you may encounter, and the way that we are going to describe pain or classify pain. Probably the most common types of pain that we see are musculoskeletal related type of injuries or pain. These include chronic back pain or low back pain, acute low back pain, and things like osteoarthritis. And unfortunately, as we get older, we start to see higher prevalences of both lower back pain and things like osteoarthritis. So we have to take that into account. We also have to realize that there is an increased percentage or prevalence of other types of diseases in the United States, like diabetes mellitus. And one of the outcomes of uncontrolled diabetes may be or result in painful type of peripheral neuropathies. There are also some other types of chronic pain conditions, like post-herpetic neuralgia. This here happens in a small percentage of patients who have experienced shingles. And shingles is a result of a reactivation of the chickenpox virus. So you could see how potentially large of a problem this may be in the United States. And actually, post-herpetic neuralgia probably affects about 1 million adults in the United States annually. So again, just showing you the magnitude and size of the different types of painful conditions that we have to deal with on an everyday basis. And that's important. It's important to understand this because, as I mentioned, when we start to understand the type of pain we have to be able to classify it. And there are different ways to classify pain. We can classify pain based on its timing, acute, subacute, or chronic. An acute pain usually lasts about 30 days, and it's expected to heal and then no longer result in pain. So it's part of that normal healing process. Subacute pain, well, some individuals have characterized this anywhere between 30 days up to 3 months. And again, during this period of time, healing's taking place, and the hope is that if you're adequately addressing the pain, it will not become chronic. And usually we're going to define chronic pain from a painful condition that is lasting 3 months or longer. And these are the areas where, unfortunately, it's going to be very, very difficult now to remove that pain totally. So you could see that there are different ways that we may address pain at each one of those stages when it comes to timing. Pain can also be qualified based on the severity, mild, moderate, and acute, and severe. So when we look at pain based on severity, again, this is going to direct different types of options for treatment. If you have very severe pain, then you're going to have only a certain amount of options that are going to be able to help address that. And that's going to be much different, those options, than if you have mild pain. So that's another way. We can also address pain based on where the pain's coming from. If it's coming from the muscle, if it's coming from the joint, or if it's coming from the nerve, or maybe a headache pain, or if it's an organ pain, we call that visceral pain. Different types of way of classifying pain. So that ultimately, when you start to understand pain and you start to take ownership of your pain and we start to make a management plan, we're able to do this in a very educated fashion. Watch, just based on what we talked about. If I see you and your pain is severe and it's lasted more than 3 months and it's affecting your joints, well, then you have a severe chronic musculoskeletal type of condition. See how that all comes together? And it's critically important that we define that pain as best as we can. We need to define it based on the timing, based on the severity. We need to define it based on other types of qualifying physical descriptions. Is it burning pain? Is it aching pain? Is it electrical pain? These type of descriptors help the healthcare provider better understand what may be causing your pain. And also understanding how long it's been going on and how severe it is are going to also allow us to come up with a plan that's going to address your needs best. Now, if you look at the role of the patient and you look at how you may be able to even shed more insight, it goes beyond just the pain itself. It's important that we look at elements like functionality. How is this pain affecting you? Are you able to do normal activities of daily living? And this can be critically important. What if you have very bad osteoarthritis in your hand? And I write you for a prescription of a medication that is an oral tablet and that you have to open the bottle. How can you effectively do that? So it's these type of real practical elements that need to be explored. Not only that, you may be experiencing pain to the point where you're not getting a good quality of life. And that can result in other types of problems like depression, which unfortunately in the literature it shows about a 38% type of covariance, meaning that you may have pain and depression at the same time. And that's not too hard to fathom. I mean, if you're in pain, you may feel miserable. You may not be doing your activities of daily living or normal functioning. It's much harder to even do simple things if you have very bad back pain, like getting up and out of the chair. And that's not going to put you in the best mood, too. So it's important to understand how that pain is affecting you, affecting the whole person. And that's why we very much in pain medicine adopt this biopsychosocial model. We want to know how it's affecting you physically, how it's affecting your psychological aspects, and how it's affecting you socially. And the better that we're able to have a very open, transparent type of dialogue, the better I'm going to be able to understand how this pain is affecting your life. Because as we make a pain management plan, it has to be a two-way street. You have to have this input from you as the patient and me as your caregiver who wants to try to not just reduce your pain and get you back to your normal activities of life, but also I want you to be happy. I want you to be satisfied with your care. There is no single therapy that's going to work in 100% of the patients 100% of the time. And pain is very individualized. And the better that you can understand the dynamics, the better you're able to classify that pain, the better you're going to be able to come up with a strategy that will address you and your problems as a whole individual and not just how bad your pain is. Well, now we've had the opportunity to discuss how we can best define our pain, at least from a severity standpoint and a timing standpoint, so that we better understand the type of pain management plan and options that are going to be affordable to us. And what we now need to think about is, how does this really affect our overall life? You know, what are we dealing with on an everyday basis? I could tell you some population statistics that here in the United States, the population pyramid is upside down, meaning there are more and more individuals who are living longer lives. And you know, being 65 years old is not old in the United States. And that's important because these individuals, as we get older, like myself and others, we're not baby boomers, we're zoomers. We're expecting more out of life. And as I mentioned earlier, unfortunately, as we get older, we're very complex biomechanical devices. We start to get wear and tear of our joints and our muscles, etc. And when we look at pain, particularly if we're experiencing chronic pain, we have to understand that the mainstay for therapy is either going to be over-the-counter or prescription pain medications, or what we call analgesics. But is that enough? I would challenge and say it's not. I think it's critically important that we adopt a biopsychosocial model, one that addresses the pain and that sets realistic expectations that we may be able to reduce the pain to a point where it's reasonable and allows us to get back into functionality, activities of daily living, and quality of life. So as we look at this biopsychosocial model and we break it down, the biological part really is focusing on how do we get good pain relief and pain control. And how do we do that within the goals of pain management? I mentioned the goals for chronic pain management are to really remove or eliminate that pain with aggressive, appropriate, and adequate type of response. For chronic pain management, it's more of a trade-off. How much pain can we reduce, and how much functionality, quality of life, and activity of daily living can we gain back for the patient? And when we look at it from a social aspect, well, that patient wants to be interacting. You know, you want to be able to go back to work. You want to be functional. You want to be able to enjoy your life from the standpoint of those things which bring you pleasure. And this will decrease or mitigate suffering. And from a psychological standpoint, that's where we understand that, you know, if you are not able to do those normal activities without pain associated with them, you're more than likely not going to be too happy about the situation you're in. So this biopsychosocial model is very important to understand. And it's very important for you to make sure that you address those issues as you create your pain management plan with yourself and with your healthcare provider. Now, it's not uncommon that we use a combination of various different types of options, either prescription type of drugs or over-the-counter drugs, or natural products, or interventions, or behavioral modification, physical therapy. When we combine all of these together, we get what is known as a multimodal pain management plan. So there's a value in you understanding what your options are. So We understand how we're going to define pain. We're going to realize how that pain impacts our life. And then we're going to set expectations on what we need and want to get out of a pain management plan. So, at the end of the day, the more educated you are, the better that you own that painful condition, and the more aware you are of these options is going to make you a more informed consumer and a more informed patient. And again, we need to have access. And that access comes in a variety of different types of options. Well, we've had the opportunity now to explore some basic concepts related to pain and some basic options. What does it mean to you? It means this now is the point where you start to say, how do I take control? How do I incorporate this knowledge into my everyday life? And it's important because, as I mentioned early on, that's step 2, you owning your pain and you setting proper expectations on what is to be expected in a pain management plan. This can be accomplished. I want you to know that. And I mentioned early on, we may not be able to remove your pain 100% as pain management specialists. But the more input you have into it, the more changes, lifestyle changes that you make, the better the opportunity is going to be that you will have a proper optimization of your pain management strategy and plan. So let's take one example, diet. If we look at the type of diet strategies that are out there, I think what we find is the first rule is that we do want to address our overall caloric intake. We want to be able to match the amount of food that we're taking in with our overall baseline need and additional type of needs like those that may come with the implementation of an exercise or physical therapy program. It's not uncommon that I get questions from patients of, what foods can potentially cause me pain, or what type of supplements could I take to maybe mitigate that? I'm very proactive in mentioning to my patients that there are certain types of supplements that may actually be matched up to either prevention or improved joint or muscle or nerve health. And at the same time, there are those which may not be the best for you as a pain patient. If we look at one class, omega-3 fatty acids, this is an area where we believe these type of natural products are going to have overall positive response for central nervous system or nerve type of health and wellness. And I advocate to my patients to try to incorporate these into their daily type of supplemental regimen. Also, folate, thiamine, niacin, these are critically important too, particularly if you have more of a neuropathic type condition. There are some studies that lead us to believe that manganese may be also very helpful for patients who are suffering from type of neuropathic pain. Chondroitin and glucosamine are two options, again, that may be very helpful to maintain good joint and muscle and cartilage maintenance or health. And proper amounts of these, I think, help us get a balanced approach when adding dietary supplements into our everyday pain management plan. So that's an area that, unfortunately, a lot of times is not focused upon, but I think should be addressed by the patient and their healthcare provider. And it takes a lot of work to find out which ones may be the best. I can give you some back of the envelope suggestions. One, make sure that whatever products you're looking at are made to the standards of manufacturing that we call GMP, good manufacturing practices. And also see if there is some clinical trials that have been done to support the use of these. And then it may be really good to speak with your pharmacist or your healthcare provider about some of the choices that you're making, particularly if you are on prescription medications, because remember, as we spoke about, potential drug-drug exposures and drug-drug interactions can happen. And that's something we have to be very much aware of. If we look at a couple other studies that have recently come out, there's some good, strong suggestions and evidence that vitamin D and pain also may be somewhat causally related. So we want to be able to look at vitamin D, and we want to be able to see what's the best type of vitamin D formulation we have. This is an example that your healthcare provider can help with, because we can actually test your vitamin D levels, as well as vitamin B12. Again, we look at B12 and we look at neuropathic type conditions. This is another supplement that, again, from the literature would suggest that it would be useful for the maintenance and for the natural upkeep of your nervous system. So there are some supplements that I think you can find. The question is, you want to pick the right one, and you want to make sure the dosing is correct, and you would like to, I would suggest that you should talk to your pharmacist or to your primary healthcare provider or pain management specialist about how to incorporate those type of options into your daily diet supplement program. There are certain things too, like some of the artificial sweeteners that I will tell my patients to try to avoid, because what I've seen in the literature and also anecdotally in practice is that some of these may actually increase the pain or make patients more sensitive to the pain. So that's another aspect that we have to keep in mind. If you look at the avoidance of nitrates, there is some literature that would suggest that this also is something that we need to be considering. Reduction in trans fats, these two are going to be suggested in the literature, and I believe also I've seen in my own clinical practice, those which may lead to a higher probability of attenuation of pain. So diet does matter, and it's not a call for you to go out and just grab everything that I mentioned off of the shelf in your local pharmacy or store, or order it online. It's more important that you understand what may benefit you the best. And it's that role that I mentioned before, this lifestyle change and this incorporation of education that makes you the educated patient and the educated consumer. But it's something that you can do and that you can have a positive impact in your overall pain management plan. Exercise and therapy will allow you to have better control of your pain and also improve your lifestyle. Sedentary lifestyle and inactivity in a chronic pain situation is more than likely going to lead to problems like obesity, and it can even lead, in the worst case scenario, to muscle atrophy. So how do we balance this? Well, we want to be able to introduce an exercise or physical rehabilitation program that's tailored to the patient's needs. And what this means is you really should be in touch with your primary healthcare provider, and that this is one of those cornerstones of a multimodal therapy. Your primary care provider more than likely can refer you out to a physical therapist or a physical medicine rehabilitation specialist. And they will be able to design a tailored program that will match your needs. This is very helpful because not all different types of exercise programs are always going to be beneficial to you, and some may actually harm or hurt you. So having the guidance from a physical therapist or a physical medicine rehabilitation physician is going to allow you to get the most out of this type of therapy. Core muscle strengthening and stretching are very helpful techniques, particularly for patients who have low back pain. And this is something, again, that we can try on our own, but probably the help of a physical therapist or even of a qualified individual who is a trainer, a personal trainer, may be able to improve your chances of success and, more importantly, from my standpoint, avoid potential danger and injury. Physical therapy programs can be very simple or all the way through the spectrum of more sophisticated. And they include lots of different options, like back school. Back school is very important. This tells you how you should be sitting up, how you should be standing up the first day in the morning, maybe stretching in the shower. These type of things are going to allow you to be more aware and more particular with your type of movements, with your maybe a desire to lift heavy type of objects that could all result in injuring you or exacerbating your current pain that you have. So do look at those type of options and do discuss those with your trainer, with your primary care doctor, physical therapist, or with your pain management specialist. Diet and exercise go hand in hand. And with these, you're also going to be introduced to a whole bunch of different modalities like acupuncture or massage therapy. And what you'll find is in the medical literature, this type of opportunities may be beneficial to certain patients who are suffering from certain types of painful conditions. So there are options that you need to explore. Recent studies on yoga have suggested this is another important option for us to consider. What I like about yoga is that it just doesn't only address the physical aspects, but it also addresses the spiritual or psychological elements too. Through meditation and yoga, what we've seen in studies is that there seems to be a trend that certain patients will respond to this very positively. And therefore, your overall lifestyle change may result in improvements in your pain management. We can look at simple types of remedies like rest and ice and heat and the alternation of these. Again, when we're considering these, it's something that probably is best discussed with a healthcare provider. And I personally believe that this is an area where if you're going to be going to the store, or you're thinking of getting some type of information online, understand where that may be of value. But rest, ice, and heat have all historically been non-pharmacological or interventional approaches that have been helpful in managing pain. So what does it mean to you? Diet and exercise are fundamental pillars of lifestyle change that can have a very positive impact in your overall pain management strategy, and are real options that you can take control of and that you can tailor to your specific desires and needs, and something that I suggest you explore. As I've mentioned, diet, supplementation, exercise, and physical therapy are all essential parts of a pain management plan. And they constitute pivotal aspects of a multimodal type of approach at managing your pain. Let's talk a little bit about topical analgesics, also known as topical pain medications. What's important to realize is that when we're delivering drugs topically, the main idea is that they will not be absorbed into your blood system, meaning absorbed systemically. And there are advantages to that. One advantage would be that if you're on other types of medications or supplements that you're taking that are in your blood, you potentially can have drug-drug interactions or drug-product interactions. So by limiting the pain medication to the skin itself, you're able to potentially avoid those. And that is something that we really need to take into consideration, because it's not uncommon that we're on multiple different types of supplements, and sometimes even, depending on your disease states, you may be on multiple types of prescription medications. So this will avoid or mitigate that with a true topical type of pain reliever. If we look at these topical agents, what we find is that they also give us the ability to be very targeted in our therapy, meaning we're going to use them where the pain is. So you want to apply or rub in that topical medication to the place where you have pain. I've had patients who have had very bad joint pain in the knee. And in these types of patients, what I'll be able to suggest to them is trying applying this to the area where the pain is, 2 to 3 times a day. And what we've seen is that in certain types of clinical studies with certain types of medications, that the topical medication may be just as effective as the medication that you would take by mouth. But again, you're avoiding the potential side effects that you would have by taking it topically, or at least reducing the amount of side effects, providing that that really stays at the level of the skin and does not get absorbed into the system. Once it gets absorbed into the system, then we're talking about transdermal delivery. So with topical agents, the real focus is to keep them in the skin, to keep them where the targeted pain relief is needed. When we think about the physiology of the skin, there's many things we have to think about. Now there are different types of pain generators or different types of reasons why you may have pain that can be addressed with topical medications. Some of them may be related to nerve pain. Some may be related to muscle or skeletal pain. And some may even be related to just the skin itself. We know that there are some painful conditions like psoriasis, where it's the skin and the makeup of the skin and the nerves that are actually the reason we're having pain. So we've spoken about many different things, and I think we've now had the opportunity to give you a little more insight into how we need to address pain so that we can personalize pain so that you can be in more control, and as opposed to letting that pain control you, and we can decrease suffering and ultimately come up with a plan that is very tailored and individualized to your needs so that you don't only reduce pain, you improve quality of life, patient satisfaction, and also activities of daily living. I have mentioned that it's very important that you embrace the multimodal strategy, which includes diet, exercise, physical therapy, supplementation, and the use of topical analgesics. And when we start to build from that point on, we want to look at other types of options too. Again, we are going to look at pharmaceutical options, both interventional and non-interventional options for pain medicine, but it really has to be a plan that focuses on the biopsychosocial aspects of pain and ultimately is tailored to your needs. You can do this, improvements in lifestyle, diet, exercise, coupled with a multimodal approach, and utilize those healthcare providers. Talk to your doctor, talk to your pharmacists and nurses. That multidisciplinary team is going to allow you to get control of your pain and ultimately come up with a very individualized, tailored, personal pain management plan.
Thank you so much, Dr. Pergolizzi, for that great presentation. Everyone, we're now going into the Q&A session.
Well, first, I want to thank you, Aaron, again, and all of the webinar attendees. I'm hoping that I will be able to answer these questions to your satisfaction. And I'm guessing that these are going to be similar questions that what I get from my patients. And I think it's important that we address these top questions. And let's go forward. Let's see how we do.
Let's jump right to your questions. The first one asks, when will this pain go away?
I wish I had a crystal ball to tell you that. What I can tell you is that the sooner that you're educated and take ownership of your pain, the better you're going to be able to feel.
What's causing my pain?
It's a good question. You know, there's a lot of patient variability or individual variability when it comes to pain. Remember, there's no one golden bullet that works in 100% of the patients 100% of the time without potential side effects. And we have to think about avoiding this concept of having immediate gratification. Instead, we need to look at the options we have, and that'll give us an understanding of how to best manage your pain.
Okay, and what are my alternatives?
Thankfully, you have lots of alternatives. The alternatives range from natural dietary supplements all the way through interventions. The concept of a multimodal pain therapy approach is one that we need to embrace, and it's something that by talking with your primary care physician, you're going to get a first step at that.
What are some non-prescription things I can do?
Diet, exercise, physical therapy, complementary alternative medicine like massage therapy, natural products, over-the-counter products. All of these, including topical pain medications, should be in that list of options that you can do that are non-prescription and non-interventional.
What are the risks and benefits of pain medications?
There are risks and benefits or pros and cons to any type of pain option that we present to you. What we need to do is understand where you fit along the benefit profile and the risk profile. So it's very important that we understand what your past medical history is, what your sensitivities are, what has worked before and what hasn't. It's hard to just pinpoint various risks for pain medicine as a whole. So you have to look at each therapy, but that's part of your job and that's part of the job of your primary care provider.
The follow-up to that, will I become addicted to narcotic pain medications?
Question of addiction is a big one, and we see it in all the various different type of lay media as well as in the medical publications. There is a potential that patients could become addicted or misuse or abuse opioid medications. That's why it's important that we look at having a opioid patient-provider agreement in place that thoroughly explains the different types of risk and benefits related to the use of this particular medication class.
Here's a good question. Why do I need to keep taking more of my medicine to have the same effect?
Sometimes what happens over time is this process called tachyphylaxis or tolerance, that over time it requires higher doses or more frequent dosing to actually get a response. This is a sort of checkpoint. If this is happening, you need to go back to your provider, your healthcare provider, and tell them about it, and it may be time to change your medications or that treatment plan.
Should I tell my medical provider that I am having pain?
It's very important that we adopt a process of transparency, and it's one that should really be do ask, do tell. That's very important. The only way that I and other doctors are going to help our patients is by you telling us what's going on. It's our job to be that investigator, that Sherlock Holmes, to keep asking those critical questions. But at the same time, you need to be also asking the questions, and you need to be thinking about how these questions and answers affect you.
Some days my acute pain is much worse. What can I do?
That's the problem with pain. It itself can be variable. You can have a constant type of pain and then during the day and then get a flare or a spike or a peak in your pain. What you need to do is tell your physician about that, particularly if it's chronic pain, because this may be a yellow flag or a red flag for the physician to make a change in your pain management. When we think about a comprehensive pain management plan, we want to address pain at all different times of the day. And so it's very important that you let your doctor know the specific patterns related to your pain.
Oh, here's a good question. How should I describe my pain to my doctor?
I think you should start off by describing it in its timing, its severity, what makes it worse, what makes it feel better. You should also talk about how it's affecting your functionality, your quality of life, and your ability to interact socially. These are all at least the bare basics that we need to talk about.
What can my friends and family do to help with my pain?
When we embrace the biopsychosocial model, that social part includes the caregivers and family members who may be suffering right alongside you. I think what's important for us to think about is bringing those people to the provider and having an open conversation. I invite my patients to bring their family members with them during the interview and during the process so that we can really understand how this pain is affecting the whole social environment that you're living in.
Here's an important one to ask. Do I have to suffer with chronic pain for the rest of my life?
Well, unfortunately, I wish I had a magic wand that could take chronic pain away. But what we find is that patients who have been suffering from chronic persistent pain, more than likely we're not going to be able to remove their pain 100%. Instead, what we would like to be able to do is come to a meaningful reduction in pain that affords you the ability to have improvements in your activities of daily living, in your functionality, make your quality of life much better, and address other things like sleep that are very important as well.
Dr. Pergolizzi, what is interventional pain management?
Interventional pain management is a division of pain medicine that focuses on using different types of procedures other than pharmacological, which may include injections, implantable devices, neurostimulation, all as a part of a multimodal approach.
Okay, and our final question for this webinar, can I spread my pain? For instance, shingles.
Your pain is not a contagious type of situation, so you shouldn't be spreading it. Now, from a biopsychosocial model, suffering, if you're suffering, the people who love you are going to suffer also. So from that standpoint, there may be some type of spreading of pain.
So that's it. Thank you, Dr. Pergolizzi. Thank you, everyone, for attending. And with that, we are done.
Aaron, I want to thank you, and I want to thank the audience who joined us on this webinar tonight for participating. I think I tried to outline a realistic approach, something that's actionable, something that you can do in order to improve the standard of pain management right now that you're receiving, and also to help you increase your breadth of knowledge so that you're the more educated patient and consumer. There's one thing I could tell you, that unfortunately we're going to have to live with pain at some point in our life. And the question is whether or not that pain is going to dictate how you're going to live, or you're going to take control of that pain, and you're going to be the one who is going to be able to not just decrease the pain, but decrease the suffering. It's very important that we work together as a team, doctor and patient, to understand what options we have. And it's important that you understand you do have these options. The better you understand your options, the better we're going to be able to make that tailored, individualized pain management plan. I know you can do it, and I thank all of you for the time you spent with us this evening. God bless you.